mamas! Welcome to this week's update on what's happening to baby and what's happening to us mamas. So we are in week 20 officially. Wow, halfway through. I'm super excited about this milestone and congratulations that you've come so far already. We are halfway there. The next half is going to be equally exciting, and then you finally get to meet your baby. Let's have a chat about what is happening to baby and to mama. So we'll start with baby. Our babies are currently around 16.5, 17 centimeters long and weigh around 300 grams. That is like 3 bars of chocolate. And if we compare them to a fruit, they are like bananas. Their skin is thin, but it is becoming more and more complex, and layers are developing, and the soft waxy coat called vernix caseosa is covering the skin to protect it from the amniotic fluid. There's a new exciting milestone happening in week 20. Our babies are growing hair and eyebrows. So on the scalp, you're going to get some hair, and the eyebrows might also start forming. When it comes to sensory development, the touch is becoming more and more refined, so they can feel more. They're already moving a lot, so now they can actually, when they touch the fluids and when they touch the sides of the uterus, they can actually receive that sensory input and actually feel it. Super exciting. And when it comes to hearing, their hearing is developing really nicely now, that they can hear your voice, they can hear your heartbeat, and they can even start responding to it. So if you want, you can do some tests and greet baby in the same way every day and say hello, or maybe in the evening. I think they're more active in the afternoons, evenings when we relax. And finally, take it easy. So you can experiment with talking to your baby and seeing if baby will be responding. The genitals are formed and they're visible. So hopefully you're going to be going to a 20-week checkup soon, the mid-pregnancy checkup. And this is a really important one. And if you don't know yet, you will find out, if you want to, if it's a boy or girl. The babies are also moving a lot. So if you haven't felt it yet, you might start feeling it now. Some fluttering, some little movements. That's your baby moving inside you, stretching, kicking, using their hands, training those little muscles of them already. So exciting. I'll put our banana away and let's move on to mama. When it comes to us, well, since we are halfway through and we are growing a growing baby in our growing bellies, we will be experiencing an increased appetite. So you might be more hungry more often during the day. And this is completely normal, so do eat more. Try to be mindful about what you're eating and make sure you get a lot of valuable nutrients in your food. Your belly will be growing because your uterus is now all the way up to your belly button. So my belly button is here. So the uterus is already really quite large, and inside there is a little baby banana. So you definitely will be seeing a growing baby bump. Because of this growing, you will be experiencing this lower ligament pain. Sometimes it can be quite sharp. It can be like a stretching pain or like a sharp pain. And you might also be experiencing the pain in your back, especially your lower back. And this is mostly because of the shifting center of gravity. Because your baby and belly are growing, this all becomes quite low. Careful there with your posture, because everything will be now kind of pulling forwards and downwards. So it's super important to do strengthening for the back and arms exercises, as well as stretching and making sure that we keep a nice straight posture. And that will also help to alleviate the pain that you are feeling. You might be feeling heartburn and have indigestion and have constipation, as well as the shortness of breath. And this is all due to the hormones, as well as the growing and expanding uterus and everything being slightly squished and pressed. And the shortness of breath is because your uterus might start pressing on your lungs. You might have some skin changes, some darkening skin might be appearing on your body, around your nipples, your inner thighs. This linea negra that will be maybe appearing on your belly button. I have some on my face. I think it started also in the first trimester. I got some spots and now they're also coming out. So what is very important is to hydrate our skin. So apply lots of body lotion and definitely protect yourself from the sun and apply sunscreen. You might also have leg cramps. So to help with that, you can take magnesium, and I would suggest big dosages of magnesium, around 300 milligrams. I forgot to take mine yesterday, so I take it daily in the evening before going to bed. It helps with the sleeping, and it also helps with the leg cramps. And yesterday I forgot to take it, and lo and behold, I indeed felt some cramps in my legs. So that was not very pleasant. So if you have that, do take magnesium. That really, really does help. And last but not least, you might be experiencing some emotional swings. This should be a lot less than in the first trimester, but you still might be emotional and get emotional. Yesterday, we did a family trip to the circus, and as the performers were coming onto the stage, I was crying away and I couldn't explain why. So there was some sort of emotional outburst there that took place, which is completely normal. So if you're having that as well, don't worry, we're in this together. So that's it from my side when it comes to what's happening to babies and mamas. Keep taking your supplements. Keep drinking a lot of water. I will be having my 20-week mid-pregnancy checkup in the next few days, so I'll give you an update about that in the coming video in week 21. That's a big one where the doctors do a lot of precise checks and you can ask more precise questions. So I will leave a link to a PDF that you can download where there are specific questions that you can then ask when you go for this mid-pregnancy checkup, so you get all the information you would like from your doctor. Thank you so much for joining me in this video. I hope to see you tomorrow in a workout video, and take care in the meantime. Bye.